Now I think you made a perfect introduction for our next three guests, Oliver, Paul, and Vishnu from Stanford University. I hope in California weather is nicer than in Berlin this morning. And you will tell us a little bit about your project, CardinalKit. And I think you can take up from Thomas with his research kit, Apple devices, and the project with all the sensors and wearables, and how to put that into routine care.
Perfect. Yeah, thank you very much. Let me grab the clicker. Yeah, thank you. I think the first two presentations are a great little segue into our presentation. We're a research group, and I believe teamwork makes the dream work. Hence, I have my team here to make the dream work. And so we're a research group, and as a disclaimer, what we're talking about today is very much from a U.S. focus, U.S. perspective. And so it's important to think, okay, well, what is our perspective in our healthcare system? What is digital health? How do we think about digital health? In our healthcare system, when we think about digital health, it basically is talking about care outside of the four walls of the hospital. So remote monitoring, and this year at HIMSS, the big topic was hospital at the home. We're even thinking about how we can free up beds in the hospital to be able to offer more expensive surgical care through digital means, preventative care, population health. And it's also, when you're thinking digital, it's very hard to find the right setting where it makes sense to implement. I think that's the hardest part in digital health, is the implementation phase. And in the US, there are three kind of payment models that are very well aligned with digital health, where they're most aligned. The first is a value-based care payment model. In the US, the fastest growing value-based care model is called Medicare Advantage. The self-insured employers, so employers in the US, such as Starbucks, they pay more for healthcare than they do for the beans that they purchase every year. So they're another group that's very interested in digital health. And then integrated delivery networks, such as Kaiser, Ochsner, these are health systems that are the payers, the providers, and they own the whole network. So that's really just to establish the groundwork. Also, it's important to talk about why now is such an exciting time in the United States for digital health. The stage is getting set. I'm not going to say it's fully set, and it has to do with changes with regard to data, reimbursement, and regulatory. With regard to data, we had the HITECH Act during the Obama administration, which paid billions of dollars to incentivize hospitals to digitize their health records so that you have digital records. And then they had the problem that the data lived in silos. There wasn't a lot of data exchange, so they came up with the 21st Century Cures Act final rule, which just passed recently, where they passed a rule to be against information blocking. They also defined data standards that are required, as well as the APIs that need to be used to help to have the health data start flowing. So that's really important on the data side. On the reimbursement side, I talked about the value-based care models in the prior slide, and we're almost at 50% Medicare Advantage of all Medicare, and the government in the US is the biggest health insurance. And through Medicare Advantage, they're trying to incentivize more value-based care. So that's another reason why digital is interesting. And then obviously regulatory, the FDA has been very clear through guidance that's published for software as a medical device and so on, in terms of how to implement what is regulated and what is not regulated. These are all things that are becoming very clear. So what's relevant to this talk and this session is that all these things put together, if you look at it from a high, from 30,000 feet, is really pushing what is being called consumer or patient authorized data exchange. The government is making very clear, you as a patient have the right to your records, and you have the right to receive them using the FHIR API in a digital manner. So really the space for greatest innovation through digital is to build on top of the electronic health record. Let's not wait for the electronic health record companies to innovate. It's really everyone here in the room and all the innovations you're creating, where the greatest innovation can happen. So we are a research group at Stanford through BioDesign, and we have three areas we focus on: education through classes, translation. So we've developed an open source framework, really, which could be used to build the talk you heard about the kind of patient access portal for records. It is called CardinalKit. Also, we support a lot of research projects on campus and beyond, which you'll hear about in the next, from Vishnu and Paul. And this is, for example, a class called Building for Digital Health that just finished earlier this year, where we took 5 real-world projects from the hospital, and we had students, computer science students, build the projects using CardinalKit, and these projects all get implemented. Some are research, some are more business projects and so on. So I'm going to give it to Paul now, who's going to talk about CardinalKit. There you go.
Thank you. We're going to make it, I'm not sure, yeah. We're going to make it a bit of an American presentation here by switching it up and having 3 people on stage here. And I'm happy to share a bit of an insight of how we see consumer health companies as an enabler for digital health innovations. And our approach in that case is not to fight these companies, but build on top of the solutions that they provide and break up the silos that they're trying to enable, to lock customers in their ecosystems. And therefore, we are attacking this, similar to how it was said in the previous presentation, by using an open source approach. We're building tools that enable digital health innovations to build on top of these consumer health companies, building products like the Apple Watch or Google and Apple offering services in their operating system, and enabling digital innovations on top of that. The tool that we have for that is called CardinalKit. It's an ecosystem of different tools that enables you to extract information out of these ecosystems, which in the long term should be regulated and should maybe be mandated by government and by regulatory bodies, and translate this into an interoperable system that can be then used to exchange data with electronic medical record systems using the primary standard we have in the US, which is HL7 FHIR. And the overall goal of the ecosystem that we're building there, and why I think we want to share this with you, is this open source community that we're building around this framework. We're having different modules and different parts that you can plug together to build your digital health solution. This is not only important for a company or like a startup, but especially also important if you think about research studies that want to build on top of these consumer health devices, which provide you very insightful data points and biomarkers that you can use in the research study, combined with clinical insights, and actually help patients to get insights about their data and provide clinicians input in the day-to-day life of the patient where you might not see them in their clinic. And the overall goal of what we're providing is this open source framework that we have, including template applications that people can start building on top of. And we use these internally, and Vishnu is going to talk more about this later on in different projects. By providing this as an open source framework and actually making this free to use for everybody with a license, which allows commercial and research use, we're trying to really democratize this access to digital health data and trying to break up these silos of these consumer health companies. And within the framework itself, we have different components that you can use. It starts from making the user informed about how the data is actually used, how we access the data, and giving the user the choice to provide consent on how we extract data from these devices and how we even collect data beyond what Google, Apple, and all these different other companies collect on these smart devices. We have possibilities to ask users about different questionnaires that are standardized questionnaires. It allows you to integrate this into your clinical workflows to enable you to build applications that might be used before you actually treat a patient, before you bring them in the OR, or even after you brought a patient in the OR. And really try to combine this with a standardized format that you can get every data that you can get out of these different applications and different tools, and actually feed them in a standardized way into the electronic medical record. And we work on iOS, which is Apple's primary platform, integrating with the Apple Watch and other connected devices that Apple provides. We're integrating with Android phones. Google has their own smartwatches, Fitbit, all these different other devices. We're trying to build this ecosystem that everybody can enable these, or can use these consumer health companies to actually drive their innovations and their research forward. And Vishnu will now talk about a few projects that actually build on top of that, and we'll share a bit more insights on how we actually use the framework to enable people to build on top of that.
Thank you, Paul. Yes, I'm glad to be here to show you some of the projects in the real world that we've developed with CardinalKit, using the modules and the templates and the starter code that we provide. This is a project called Buddy, and essentially it's for children who have a condition called cerebral palsy, which is a motor neurological condition where the children are unable to have proper upper motor body strength. And one of the mainstays of the treatment is physical therapy, but usually the children have to go to a therapy center regularly to get that therapy, and it's not as easy to do that effectively at home. So what Buddy did is to take the commercial Apple Watch that you can buy from the Apple Store and use the sensors to be able to detect the motion in the arms when the child is doing the exercise as shown on the screen, and provide them live biofeedback as if a physical therapist was with them there in the room, and that's very effective. This is another example. Contact dermatitis is a very common condition. But unfortunately, very few people actually do get tested to find the definitive allergen that is causing their condition, only about 2% in the United States. And this is due to, one, access to the facilities that have the ability to do these tests, but also the cost of this testing. So what we've done with CardinalKit is develop a system where people can have the test kits mailed to their home, and then they can use a mobile application that leverages augmented reality and machine learning that's built into the iPhone in order to conduct the test properly and get the results sent to a provider remotely, so they don't actually have to travel to a clinic. And we can do this a lot cheaper. And finally, there's been a lot of talk about LLMs, large language models, and GPT. And so this is our recent project that we actually just launched last week, where we're leveraging ChatGPT in order to allow patients to better understand the data that is already on their mobile devices, such as their fitness data, nutrition data, health record data, et cetera. And they can actually speak to HealthGPT, the application, using natural language, and ask questions and get useful insight. And now what we're trying to do is investigate ways in which we can do this in a more privacy-preserving manner, such that the data is processed on the device itself using local models as opposed to sent out to the cloud. But it's really an interesting area of research.
Yeah, and that's it. Thank you. You have 3 minutes.
Okay.
Yeah,
Okay.
perfect. Okay, danke.
Thank you very much. And if you want to have a look at this HealthGPT demo, there's a little preview I found on the Twitter profile of Vishnu. So please go to the Twitter account of Vishnu and have a look at the HealthGPT demo. Even our Minister of Health, Karl Lauterbach, mentioned LLM models, LLM tools, and probabilities and possibilities and opportunities in his keynote yesterday. Okay,